Welcome to the California Healthy Places Index, a tool designed and produced by the Public Health Alliance of Southern California. This interactive, online mapping application is feature-packed, and I look forward to sharing some highlights in this video. Before we dive into the map, let me provide some key context for this new tool. The Healthy Places Index uses an intentional and positive asset-based frame to display and explore community conditions in neighborhoods across California. That starts with our name, the Healthy Places Index, and our color scheme used to denote the range of healthy community conditions. Instead of reds or oranges, both associated with historic redlining and other negative connotations, we opted to use shades of blue and green across the map. Here, dark green represents places with the most healthy conditions, and it goes along the spectrum from light green to light blue, and finally to dark blue, which represents areas with fewer healthy conditions. Not surprisingly, communities that have faced significant divestment over time have fewer healthy community conditions today. Yet we know that every community has many factors at play, and regardless of the shade of blue or green on the map, every community has assets. We think the Healthy Places Index is uniquely designed to celebrate and recognize the health opportunities present in neighborhoods across California. With that in mind, let's get started. To find out your Healthy Places Index score, you can zoom into the map and click on a tract, or you can jump directly to a place you're interested in by using the search bar, here. It works just like many other mapping applications. You can type in a town or city, or even a specific address. Let's go to Redding in Shasta County. Now, when you select a tract, this details panel on the left will open. The first item is the Hpi score, followed by a visualization of where this score falls within the 4 quartiles, from least healthy conditions to most healthy conditions. There's also an interpretation sentence to help you make sense of the score. Below the Hpi score is some information about the tract, followed by our 8 policy action areas. Each policy action area is accompanied by a mini score visualization indicating each policy action area's percentile rank. Let's take a look at the education policy action area and learn more. When you expand it, you'll see a list of every indicator it contains as well as their percentile rank. Immediately, you can begin to see the nuance that the Healthy Places Index affords. While the overall score on this tract may indicate fewer healthy conditions, it's not uniform. There are indicators, such as high school enrollment, that this community is doing really well on. You are able to quickly identify the positive assets in a neighborhood as well as those conditions in need of improvement, the health opportunities of this community. If you see an indicator of interest, such as bachelor's education or higher, you can click further to get more information. As with the overall Hpi score, you'll get a visualization and interpretation of this indicator's percentile rank in this census tract, as well as a host of specific details about this indicator, including a straightforward definition, the indicator's value, and here, how this indicator connects to health. This connection to health text provides important context and simple language about the linkage between this indicator and health outcomes. Our goal with the Healthy Places Index is to make it easy to take data and turn it into action, giving you the tools to improve your community's health. That's where this section, Policy Actions to Address This Indicator, comes in. For each of the Healthy Places Index indicators, we've provided detailed policy guides that offer specific, actionable, and relevant policy solutions. When you click on any of these links, you are redirected to that section of the policy guide on our website. For each policy, we provide a short description, examples of the policy in action, and links to reputable resources for detailed guidance on implementation, toolkits, templates, and in some cases funding opportunities. We've also included these benefit buttons throughout the policy guides, flagging where policies have extra benefits. You can hover over the button for more information. To go back to the map, just close this window. From the indicator view, you can return to the policy action area and overall Hpi score by clicking the back button here. Now let's take a look at the other features and functions our map tool has to offer. To start, we're excited to announce that the Healthy Places Index is now available at geographies beyond the census tract, including counties, cities, as well as various state and federal legislative districts, Oshpod Medical Service study areas, and more. At any time, you can change the geography you're viewing here. You can also select indicators to view beyond the Healthy Places Index using View Indicators here. This function lets you view individual HPI indicators, as well as a full complement of decision support layers, accessible here. This ability to view supplementary data layers is useful for finding health outcome problem areas, or areas at increased risk from climate change, and learn more about the community conditions on the ground. As we hear from users about what layers are useful for their work, we plan to continue building out this list, adding layers to respond to interest. Next up, you can use our rank function here to quickly identify the highest and lowest ranked tracks in your area of interest. This is a useful tool for finding high and low ranked problem areas in a community and might help answer questions such as where should we direct resources and what areas are most at risk. Moving on to our pool function located here, this lets you create your own custom aggregations or pools of geographies to suit your needs. We think this function could be especially useful for grant applications where you might need to generate an overall HPI score for a project area or to get an estimate of an individual indicator in your custom geography, such as the employed population or access to automobiles, for example. Your custom pool can also be used with the rank function to quickly identify how it compares to other nearby tracks. Sometimes you may need more information than what the Healthy Places Index, individual indicators, or decision support layers can provide alone. We designed the custom score function available here to address that. Here, you can combine individual HPI indicators plus decision support layers to create a custom score that specifically reflects your needs and priorities. You may want to create a custom score to quickly target areas with overlapping risk factors, or perhaps expand our HPI to include indicators that are important to your specific area of work. We've also built in a data upload feature that allows you to upload your own data and use it in conjunction with our available layers, including the Healthy Places Index. To save your data layers, you'll need an HPI Map Premium account, which you can sign up for here. Finally, there's a robust customizable report function accessible here that allows you to easily communicate your findings in a nicely formatted, ready-to-share package. Thank you for watching. This concludes the introduction of the California Healthy Places Index map. We encourage you to try it out for yourself at map.healthyplacesindex.org and visit us on the web at healthyplacesindex.org for bite-sized video tutorials on every map function, data downloads, communication tools, and other key resources.